the Chief Medical Officer and Dr. Fitzgerald's update.
Thank you, Premier. Good afternoon. Thank you for joining us today. Once again, I'll begin with an update on the numbers. Since the media briefing yesterday, we have 9 new positive cases. These are all within the Eastern Health Region. Public health contact tracing is ongoing, and everyone considered contacts, close contacts will be advised to quarantine. The total number of cases in our province now is 226. By region, we have 216 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 6 in Labrador-Grenville Health Region. 54% of cases are female and 46% are male. By age, we have 20 people under the age of 20, 33 between 20 and 39, 33 between 40 and 49, 50 between 50 and 59, 47 between 60 and 69, and 43 who are 70 and above. 8 people are in hospital due to the virus. Of these patients, 2 are in intensive care. 32 people have now recovered. In total, we have tested 3,776 people. Today, I am deeply saddened to report that there has been a second death related to COVID-19 in our province, in the Eastern Health Region. The individual was 61 years of age and was admitted to hospital from her home. We extend our sincerest and most heartfelt condolences to the family at this time. I must also report today that since yesterday's media briefing, we have learned of an individual residing in a St. Lawrence long-term care facility who has tested positive for COVID-19. The family of this individual, as well as the families of all other residents, have been notified. Outbreak protocols within the facility were immediately implemented, including extra cleaning and disinfecting and staff screening. Testing of all residents in close contact with the individual and those in the neighboring unit will be completed today. As we have seen, COVID-19 is a serious disease that can infect anyone, regardless of age, health status, or geographic location. This is a stark reminder that we must remain vigilant to help prevent further spread within our communities. The safest assumption is that the person living next to you has the virus. This does not mean it is okay to publicly shame a neighbor you suspect may have been exposed to the virus. Stigmatization and discrimination will not protect you from infection. Instead, support your neighbors to seek advice regarding testing and isolation. You can still protect yourself through proper hand washing and staying at home unless it is essential to go out. In fact, staying at home as much as possible and only going out when absolutely necessary is our best defense against COVID-19. This does not mean running to the local convenience store for one-off items or bringing your children with you to the grocery store if you can avoid it. Make a list of things you need and have an adult in your household go once a week to pick them up. For parents who must bring their children with them, please consider ordering your groceries and essentials online and calling ahead for prescriptions. This is not only for your protection, but for that of essential employees as well. As a recap for those who may have just joined, we have 9 new cases since yesterday's media availability. The total number of cases in the province is 226. The breakdown by health region brings us to 216 in Eastern, 3 in Central, 1 in Western, and 6 in Labrador-Grenville Health. This is no doubt a difficult time for us all, and it has never been more important for us to take care of our own mental and physical well-being. While this is definitely not our typical spring, the days are longer and the weather is improving. If you are not in self-isolation or quarantine, try to get outside for a quick walk or stretch. Use this time to reconnect with family members within your household and with others through technology. Keep a regular daily routine or create a new one that includes exercise, mindfulness, and relaxation, as well as healthy eating, which can help alleviate the stress many are experiencing. COVID-19 has shown us how vulnerable we are, but also how connected and dependent we are on each other. Please continue to stay safe in your bubble and do not break anyone else's. Our collective actions will have a significant impact on how COVID-19 progresses in our province. Thank you.
Well, thank you, Dr. Fitzgerald. So we are facing another heartbreaking day for our province, and I am saddened to say this as we head into week 4 of our public health state of emergency with this extremely sad news. Today we have another family mourning the loss of a loved one. This is the second death of a resident within our province due to complications of COVID-19. Our first death was on March the 30th. This is not what we wanted to see today, not what we want to see any day. So I will also take this opportunity to pass along my deepest condolences to the family of this woman. I'm sure she will be greatly missed by her family and friends. Once again, I ask that we respect the privacy of the family. Think about it. Put yourself in their shoes. This could be the situation that you could be in tomorrow. And as we know that Newfoundland and Labrador is a large province in geographic terms, the population might be small, the communities are spread out. So today I'm going to talk a lot about what's on your mind, and that is essential travel. You know that we are a traveling society, whether we work, medical appointments, and how we like to visit family. But we're telling you, do not travel unless it's completely, absolutely necessary. This is not about, as Minister Haggie has said, this is not about finding loopholes. This is about saving lives. And since the start of the pandemic, we've been strongly urging people to stay home. Now, the vast majority of people in our province are following the advice of Dr. Fizgerald. They're following the directive to travel only when it's absolutely necessary. That's the right thing to do. It's the mature thing to do. It applies to every single region of the province. There are no exceptions. So it doesn't matter if it's the Great Northern Peninsula, if it's Notre Dame Bay, the Burin Peninsula, or Central Labrador. There are no exceptions. Now, we hear concerns about traveling within the province. The decisions of Dr. Fizgerald is making, they're based on evidence, science, and professional medical judgment. The exemptions that are in place are to ensure essential services and infrastructure is maintained. Maintain for you to be able to get access to essential goods, food, pharmaceuticals, medical appointments. She has already stated that every person coming into the province must self-isolate for 14 days. In addition, only people that are asymptomatic. If you're an essential worker, you must be asymptomatic. Any symptoms, you cannot travel. And for those of you that are following those guidelines, I want to say thank you. Now, I know there's been considerable discussion in Labrador in recent days regarding travel of essential workers. So it's helpful to look back at what has been done and what is being done. As an example, the ferry service from the island to Labrador. Labrador Marine established stringent measures 2 weeks ago. So now there are checkpoints where you travel and you answer a series of questions about your travel and your health. Passengers who present with symptoms are not allowed to board the ferry. They have now reduced the number of passengers to 53. And as of Sunday of this week, ice conditions have improved. The Comatec W returned to making crossings between Blanc-Sablon and St. Barbe. Fewer than 20 passengers made the crossing each way, and we anticipate, based on the reservation system, that will even decrease. There will be even less traffic in the coming days. And that is only for essential services. So I want to thank Labrador Marine and its staff for undertaking these measures, including the extra cleaning that they've been doing to ensure that the ferry is safe. It is a safe environment for the traveling public. Keep in mind, it's essential travel only. What about air travel? So in our province right now, with the limited travel by Air Canada, we really have only PAL and Air Borealis. They're the only service provider for many of our communities. Maintaining essential connectivity across the province, well, that's critical. So if you travel with PAL or Air Borealis, you'll see safety measures in place for such things, passenger screening, cabin sanitization, and the passengers sitting in the back will load first. This will allow the staff to put in place better physical distancing, so you load from back to the front. And we've been also engaged with the Inuit and the Innu community governments to screen passenger lists to ensure those that are traveling are deemed by those governments to be essential. So we want to thank them and their staff for this work and their continued dedication to protecting the people of our province. So what about the driving? What about traveling by ground? So keep in mind that the provincial police force in Quebec has teamed up with the RNC and the RCMP to set up border patrols near Fermont and Blanc-Sablon. So unless you're heading to the ferry or you're heading to the airport, you'll be told to turn around. For those in Labrador who travel by snowmobile, we have suspended grooming operations. Now you might see some markings, trail markings, and that is to ensure public safety. So do not travel unless it's completely necessary. Think about what you're doing. Stay home. Now, I am aware of the positions that the councils in Labrador West and Happy Valley Goose Bay have taken for additional travel-related measures. And we will continue to work with you, work together, provide guidance to local governments throughout the province. We are on the same page here. We share the same goal. It's to protect our residents. So before you're thinking about traveling to Labrador or anywhere else in this province, don't do it unless it's absolutely necessary. You do not want to be the vector of COVID-19. A lot of people would ask about extra enforcement. For me, if you're old enough to drive, if you're old enough to get on a ferry, or old enough to get on an airplane, you're old enough to understand the rules. Now, as we head into the Easter weekend, we have made a decision to give our grocery store operators an option of opening up on Good Friday. These are not easy decisions. This is about maintaining physical distancing and giving customers and the operators the opportunity for the customers that would be in your store, could make their stores extremely busy on Saturday. So this is about protecting you and for 1 year only. In addition to that, we remain committed to the plastic bag ban, and we acknowledge there are public health risks at reusable bags. So we are extending the deadline to October the 1st. If there's one thing that we can do above anything else, is we need to realize that our actions today determines the future tomorrow. So let's be responsible. Let's take control of this virus, or it will take control of you. I now turn it over to Minister Haggie for a few comments.
Thank you very much, Premier. As Dr. Fizgerald said, we've had another sad occasion with the passing of a second patient from COVID-19. We've also reached another milestone in that the disease has now found its way into a long-term care facility. And this is a cause of some significant concern to us. But as Dr. Fizgerald referenced, public health are up to the task and are dealing with the contact tracing as we speak. And also there will be some operational changes to the facility in St. Lawrence to allow care to be provided for those people who need it in the community. As I said yesterday, now our case numbers have risen over the 200 mark. I think there is a public health need to show quite clearly that this is a disease that is no respecter of geography. It is not the towny virus. It's not a metro issue. There are numerous communities around Eastern Health and across the province where cases will be identified. There will be a table put up today on our website, and as soon as we can resolve a couple of issues with postcodes, we will be mapping that too for those who prefer a more visual look to it. I think the key that you must take away is that just because your community isn't there, it is not in any way safe to assume that the virus isn't with you. The most sensible, safe way of dealing with this is to assume that the next person you come into contact with has COVID-19 and treat them and yourselves accordingly. No one is immune to this virus. It has no vaccine, it has no cure, and it has no specific treatment. I get a lot of emails each day, and one came in today from a scholar who'd been going through the memorial archives and picked a quote from November of 1918 in relation to the flu pandemic that killed almost as many people in this province as our soldiers who died at Beaumont Hamel. And he said, the commentator said, ignorance and indifference are always the hardest obstacles to overcome in combating any disease. I don't think, given the nature of social media and the information flood that is out there, that anyone now can claim ignorance as any kind of defense. It is up to you to act sensibly. Indifference is our biggest problem. Premier has highlighted and stressed the issue of travel. I would like to take that one step further and to say that travel is not just about ferries. It's not just about the highway, and it's not just about getting on an aeroplane. Travel within the community is crucial. And coming up to Easter weekend, which is a big holiday weekend, where families have traditionally in this province got together and enjoyed each other's company. We need to do that this weekend in a different way. We can do that with the technology that allows us all now to be informed. We can FaceTime, we can Skype, we can use technology and see each other, yet remain physically separate. The other form of travel around the community that has been brought to my attention is that particularly of young folk, and teens in particular, who get together and spend an evening on the parking lot with the windows wound down and enjoying each other's company. And indeed, if you look at the age range of our patients now who have COVID-19, you see that the age is shifting into that younger group. I have 3 daughters, and when they were out in their car, or my car, they knew they had to be home at a certain time. And if they weren't, they only did it the once. If your teen is out there doing this in your vehicle, it's time for a parent to stop worrying about the reaction and maybe parent a little bit stronger than you have done before. It is in everyone's interests to do that. There are also social activities that would go on this weekend. I'm aware of running clubs, for example, who have preparations for the Telly 10, if that's able to go ahead. Again, if you're going to run, it's great. You should be symptom-free, not in isolation, and you should be physically distant. So once again, I would appeal to all of you to stop looking for loopholes. There is no way you can continue to try and find them to behave as normal. Normal has changed, and you need to recalibrate to the new normal. So build a bubble for yourself and your family, stay in that bubble, and don't burst anyone else's. And by doing that, we can push this disease down the road, and when it does come, it will come in numbers that we will be able to manage. It's up to you now. Thank you. Thank you, Premier.
Thank you, Minister Haggie. We now turn it over to the media for some questions.
For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. We will run through the telephone queue, and I will call each reporter by name to ask their questions. Please do not press *1 until your name has been called. Following this, should time permit, reporters will be individually asked for single questions. This call will end at 2:59 p.m., and any further questions can be emailed. Our first questions today are from Elizabeth Whitten of All Newfoundland Labrador.
Ms. Whitten, please press *1 on your telephone keypad at this time. Thank you. Your line is open. Please go ahead.
Thank you. Last week, Ontario ordered certain construction projects stopped, like home building projects. So now projects can be completed, but there can be no new starts. Is the government here considering any changes to previous instructions?
So when you look at we certainly take the advice from the chief medical officer on issues like this. And what we know that in We have, a fair amount of rules that are in place when it comes to physical distancing, the proper hygiene, what would be required on site. We have OH&S inspectors that will be available and have visited many sites within the province to make sure that those practices are kept. So what we're looking at right now is with very limited household construction within Newfoundland and Labrador. As we speak today, it would be very limited, just given the nature of the seasonal pattern to this. So if we are ever in a position that regardless of what the type of construction would be, if we cannot and are not able to do that using the guidelines that the Chief Medical Officer had put in place, well, these are things that would be suspended.
Thank you. And this is a question for maybe the Minister or the Dr. Fitzgerald. Do we know how many people in the province have been ordered to self-isolate?
My understanding is from the point of view of staff, I can give you that number. There are 334. In terms of those people who, for example, may have returned from out of the province and were met at airports and told to self-isolate, we don't have that number to hand.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please press star 1.
Mr. Jackson, please press star 1 at this time. Thank you. Your line is open. Please go ahead.
Hi. I understand that nurses have been told by their employers not to throw out N95 masks when they're done, which implies that the department is looking at possibly re-sterilizing them. What is the status of this at the moment?
That is a recommendation we've received through Health Canada. I know other jurisdictions, Manitoba and Ontario, for example, are currently doing this. The federal government have invested an enormous amount of time and effort in trying to identify ways where these masks can be safely sterilized and reused. And my understanding is they'll be coming out with recommendations as to how to do that within the next day or so.
Okay. And I also understand that there are as many as 15 to 20 nurses who are actually going through occupational health and safety procedure because they refuse to work with patients without proper protective equipment. Is that going to be a problem given the amount of time it usually takes to go through OHS if such refusals pick up momentum?
I couldn't comment on a specific number if staff have regarded their workplace as unsafe. I can certainly go back to the regional health authorities and find out what they have on their plate and report back. I'd be happy to do that.
Okay. Thank you.
Our next questions are from Ben Murphy of VOCM News.
Please go ahead. Your line is open.
Thanks. Dr. Fitzgerald, you mentioned the criteria, or Mr. Haggie mentioned the criteria for recovery there last week, but has there been any update around the possibility of contracting this virus twice or any long-term respiratory effects?
So with regard to contracting the virus twice, there's not any definitive evidence out there right now on that. Most people, once they become infected with a virus, will develop an immunity to it for a period of time. At this point, we don't know definitively how long that immunity lasts for COVID-19, but we would expect that there would be some level of immunity if somebody had the virus. So we would not expect people to get it twice, certainly not very close together. The test we use is quite sensitive, so sometimes it may be picking up dead virus particles or something like that, so someone may get two positives fair distance apart, which may make it seem like they have another infection, but that may not be the case. And with respect to the second question you had with respect to severe disease, sorry?
Yes.
What specifically were you wondering?
Just if there would be any possible long-term respiratory effects from this.
So again, where this hasn't been around for very long, we can't really determine if there would be long-term respiratory effects. We do know that it can affect the lungs significantly, and certainly for people who already have underlying lung disease, that could impair their function further, and that could be potentially a long-term thing. And that's true of any pneumonia that somebody may get, but the evidence is not there at this point just because we haven't had enough experience with this virus.
And Minister Haggie, has there been a directive to hospitals to not admit anyone unless they have COVID-19? Because we know of some cases where people are very sick, would normally be admitted, but were turned away or ambulances refused to come.
No, there's been no directive along those lines. I know in Ontario they have. The issue as to whether or not an individual goes into hospital is a clinical one at the moment, and is based on the assessing physician at that facility. As to ambulances being turned away, I haven't heard of that, and if you have some specifics, I'd be happy to look into that for you.
Okay, thank you very much.
Our next questions are from Craig Westcott of the Shoreline.
Thank you. Please go ahead.
Oh, thank you. This being my first time on the loop, I'd just like to thank you guys for all your hard work and dedication. My first question relates to the economic impact of this pandemic with a view to keeping essential services going during the quarantine. What is the thinking on people who have recovered from COVID-19? Are they safe to return to the workplace? Is it possible for them to still spread the virus?
So once somebody has been considered recovered and their symptoms have resolved, then they are not considered contagious any longer. And certainly with regard to healthcare workers, we are actually holding a higher standard and expecting them to have 2 negative tests at least 24 hours apart before they're able to return to the workforce.
Okay, thank you. One of the lessons that seems to be coming out of Italy is that it may have been a mistake to treat COVID patients in hospitals, that it might have made more sense to treat them in special isolated quarantine facilities devoted to virus victims only. Have you given any thought in preparation for the next wave of this infection, which is expected later this year, to setting up separate facilities for COVID patients like we used to do with TB patients at the old sanatorium?
What we have done currently with the preparations for this wave, which hasn't arrived yet, and I think that's a useful point to emphasize, we're still in the run-up to when it's going to get the numbers picking up. So we have within each RHA designated areas within facilities to deal with COVID patients. And they've been chosen for a variety of reasons, particular for their facilities. So for example, in Metro, the Health Science Centre will be the location to which all COVID patients will be sent. In James Payton in Gander, there is a unit set up there which actually has negative pressure for the whole floor, and that's currently being modified in readiness. When we see how that works here, we will then be in a better position to figure out how best to deal with the waves that may come after this one.
Thank you.
Our next questions are from Patrick Butler of Radio Canada.
Mr. Butler, please press star 1 at this time. Thank you. Your line is open.
Hi. St. Pierre-et-Miquelon discovered its first case of COVID-19 over the weekend. That territory has a very limited hospital capacity and has a healthcare relationship with this province. Have you spoken with French officials about the situation, and can you talk about contingency plans that are in place in relation to St. Pierre-et-Miquelon?
What we know is that, as you say, there is the first person who's tested positive. Their relationship for physical health lies with Eastern Health. My understanding is the individual concerned is well enough to be managed in the community. And related to the previous question, the bulk of our positive tests are in people who are currently out in the community. Our hospitalization rate is actually probably of the order of 5 or 6%. Should that individual require care, then obviously Eastern Health would honour its arrangements. I haven't spoken to any French officials specifically about this situation, but I'm happy to do so either solo or in conjunction with Intergovernmental Affairs and the Premier's office.
And you mentioned earlier about giving some more granular information about where cases are located in the province. Why now? Why is this an important step to take at this point?
The issue of public health interest versus privacy concerns is always a tension in epidemics and pandemics. We have a statutory obligation, as well as healthcare providers a professional obligation, to maintain the confidence of patients where at all possible. It's only in a situation where there is an overriding public good to revealing it that we would do so. Now, with numbers over 200, it's possible to identify community clusters without the risk of identifying particular individuals. The exception to that has been in those cases where a healthcare facility has been involved, because even though there might only be one case that could possibly be identified, that issue of the disease in a healthcare facility of itself is a public health concern. So the balance of benefit is with revealing it rather than not.
Our next questions are from Kellyanne Roberts of NTV News.
Minister, we've spoken extensively about personal protective equipment when it comes to frontline workers. What's being done for mental health initiatives? Because they're dealing with more than we've ever had to deal with on the front line in terms of removing support from hospitals, family members. What are we doing for frontline workers' mental health?
If a mental health worker is required to see people with COVID or run that risk, then personal protective equipment is available for them. One of the challenges has been around how best to deploy resources that would normally travel between facilities and communities. And for example, social work, speech language pathology, those kind of things. We've been conscious about trying to see where the greatest need is and see how we can minimize travel. Obviously, virtual care is an option, but in the situation, for example, of speech language pathology and swallowing assessments for people who've had strokes, that's going to be very difficult to do by virtual care. And so in those situations, if appropriate, the appropriate PPE would be provided.
I'm sorry, I think you misunderstood my question. We know we have bridged the gap for those in the public, but what about frontline workers who are having to see and deal with more than they ever have before?
I'm with you. We have resources for that too. Those resources available for the public are also available for healthcare providers. And indeed, one of our challenges has actually been to point healthcare providers in that direction. There is a kind of sense of immunity sometimes in some healthcare providers, and they feel it's a sign of weakness maybe to acknowledge that. It isn't. You're human like everybody else, and I think people need to realize that, and you do too. Set against that, we have a very vigorous employee assistance program through each of the regional health authorities, and I would encourage anybody who feels stressed beyond a certain point that they can cope with to reach out to that. I do know, for example, that the Medical Association has a very robust physician health program in conjunction with some of the mainland associations. So there are resources out there, and it should not be too difficult for those staff to avail of it if they feel they need to.
Thank you. I'm not sure if that counts as my second question or not with a clarification. In case it doesn't, there was a letter sent to you and Premier Ball last week that nurses wanted to be able to use their own clinical judgment when deciding what PPE to use. Is that meeting set to happen?
Though those meetings have happened, I mean, we have had frequent communication with not just the Nurses Union, but NAPE and Allied Health Professionals, QP, the Medical Association, these kind of things. There is now an agreement on PPE, as far as I understand it. There are guidelines that have been agreed by all, and given circumstance, has a given kind of level of personal protective equipment that's necessary, and that's provided.
Thank you.
Our next questions are from Peter Cowan of CBC News.
Please go ahead. Your line is open.
In St. Lawrence, long-term care homes are a big concern. We've seen places like Ontario where the disease has spread very rapidly, and these are very vulnerable populations. Can you speak to how this person may have contracted the disease, considering visitors aren't allowed? And what specific measures, you mentioned in general sense, but give me some of the specifics of what they're doing in order to make sure that it doesn't spread.
Okay, well, going back through the possible chain of events, this person's period of exposure actually also spans a time when a single visitor was allowed as well, because the changeover was less than 14 days before this individual became symptomatic. So it's not clear whether it's a visitor or a member of staff who may have been in a position of passing the infection on to this individual. In terms of what specifically is happening in St. Lawrence, this individual's unit has all been screened and tested. The surrounding unit will be. The staff have all been approached by public health and given appropriate advice. It is a hybrid institution in the sense that it also has a walk-in Category B emergency department, and those facilities have been temporarily relocated, my understanding is, to the Burin Peninsula Healthcare Centre. So there will be some changes operationally there. Obviously, what happens next will depend on the degree of contact tracing and what those results are, and also the advice from any other cases that may appear within the unit.
Over the weekend, you talked about expanding testing to include healthcare workers with symptoms. Why not include everyone with symptoms, especially since we have seen community transmission?
We are looking at using our testing resources as effectively and efficiently as possible. The public health experts in the province, the public health experts in Canada say quite clearly that your best effective use of testing is to use vigorous, relentless, I think was the word, contact tracing. And that has been and continues to be our approach here. We have broadened that to asymptomatic healthcare workers because of the vulnerability of the populations we're dealing with, and the fact that some of these healthcare workers may also share shifts with other facilities. That latter piece, and I should have referenced that in my first answer, the floating of staff between facilities on the Burin Peninsula ended as soon as we knew this situation has arisen, and will not resume until we're sure it's safe to do so.
Thank you. We'll now take single questions from our reporters. Do we have a question from Elizabeth Witt of All Newfoundland Labrador?
Ms. Witten, if you have a question, please press star 1 at this time. There are no questions at this time.
Peter Jackson of the Telegram.
Your line is open. Please go ahead.
Hi, the Federation of Independent Grocers, and among others, have been calling for a temporary halt to the ban on plastic bags. Is that something you'd consider doing?
Yeah, Peter, in my remarks there, I mentioned the impact as regards to public health safety, that we would be, the ban for the single-use plastic bags initially was for July 1st. We've now extended that until October the 1st of this year. And this was as a result of, communication that we had with them and some of the concerns of staff members around essential workers, grocery store workers, and some of the things around cloth bags that they would have seen. And there was a degree of people being uncomfortable. So we want to respond to those essential workers. And so we've extended the ban on single-use plastic bags now until October 1st. And the reason why we're making that decision now is to give operators the opportunity to actually purchase a supply that would be necessary. And we also know that with deliveries and as pickups, I should say, in advance, and now we'll be able to use plastic bags only. And I think from a public perspective, they see that as a safer option.
Do we have a question from Ben Murphy of VOCM News?
Please go ahead. Your line is open.
Thanks. Premier Ball, we've heard concerns about transport truck drivers not being able to get into public bathrooms. Now we're hearing of the same thing, but with Metro bus drivers. What do you say to them, or at least the businesses not letting them in?
Well, for Metrobus drivers, we could certainly work with the City of St. John's. That has not come to my attention. The truck drivers did. We addressed that. We work with the Salvation Army and Marine Atlantic. It's been very successful. What's happening now in Port aux Basques, both as truckers and essential drivers leave the island and those that come to the island. We also know that some of the restaurant outlets like Tim Hortons and so on will be holding special days and events and providing opportunities for truckers as well. So when we, if it's something that we need to get involved for Metrobus, we'll certainly be more than willing to do that as well. We realize that these are personal stops that people would need, and we want to work with all those people that provide essential services so that they can maintain and have access to the types of services that you just mentioned.
Do we have a question from Craig Westcott of the Shoreline?
Please go ahead. Your line is open.
Thank you. Captain Sid Hines of OceanX spoke publicly the other day about the precarious nature of that shipping service given the downturn in traffic, and he suggested that he might be going to the province to look for help. I'm just wondering what your sense is of the state of the security of that supply line to the province.
Well, it's an important one, Craig, and great to hear you. This is the first time, as you said, that you've been on this call, so it's great to hear you and the great work that you're doing and the people that you actually correspond with. So yes, we've met with Captain Hines and with OceanX and some of the officials at OceanX last week. We went over their concerns, seeing a drop of 25% of the shipments coming into the province. And we have Marine Atlantic, of course, too, that they do bring in goods and services to Newfoundland and Labrador, but to lose a service like OceanX would have a big impact. They provide anywhere from 50 to 75% of the goods, we're told, at least by OceanX, of products that come into Newfoundland and Labrador. And so right now we'll continue to work with them. I know they are working with Transport Canada and the Department of Finance in Ottawa. They've asked us to help them in that regard as well. That is something that we're doing. And they are an essential service, just deemed recently by a ruling that's been put in place. So it's important for us to maintain that second opportunity of OceanX added to the work that Marine Atlantic is doing. So we're more than willing to work with the group at OceanX to offer any and lend any support we can.
Thanks very much.
Do we have a question from Patrick Butler of Radio Canada?
Please go ahead. Your line is open.
Hi, I want to ask a follow-up related to testing. Nova Scotia just released its latest numbers in the last hour. They've conducted something like 10,000 tests since the pandemic began, and they have less than 300 cases or confirmed cases of COVID-19. Here, we also have less than 300 cases of COVID-19, but we've conducted far fewer tests. How do we explain that difference? When people look at the numbers from the neighboring province, everyone is assuming that we're following the same guidance from the Public Health Agency. How do we explain that?
Our testing per 100,000 population across the province is 714. In Eastern Health, it's 905. Those figures, certainly the Eastern Health one, is in the center of the pack. It's explained by the distribution of cases and the fact that we are using our testing and personnel and PPE in a very focused way to make sure that we do vigorous, relentless contact tracing and identify cases that way. That's why you see the variation that you do between RHAs. But overall, our rates for our population are not that different than the rest of Canada.
And Patrick, if I could, I've actually spoken with Premier McNeil in Nova Scotia, and I'm sure Minister Haggie has spoken with his officials too, and he's correct in saying that 905 people tested per 100,000 in Eastern. What's happening in Nova Scotia is that they have a more the dispersion of the cases that we're seeing, is what I'm told, is it's much larger. For us, when we get most of our cases, some 216 today in Eastern Health versus outside the province. So given where the vast majority of the people would live within the Eastern Health area and the target and strategic testing that the Minister just described, we're well within the range of where Nova Scotia, British Columbia, and British Columbia has been at it for a much longer period of time. We're at 905, and as of today, British Columbia has been doing this much longer than us. We're at 949. So people they can be relieved in saying that when you need testing, based on the targeted testing that we're doing, we're well within the pack of what other jurisdictions are doing.
The other piece I think it's worth reiterating, and I've said it in other contexts before, is that west of Fairhaven, we are a territory. If you compare our figures per 100,000 in the regions outside of Eastern Health, we're way ahead of the territories in terms of our testing. And so I think it's trying to compare apples and oranges, quite frankly.
Do we have a question from Kellyanne Roberts of NTV News?
Please go ahead. Your line is open.
Thank you. Minister, we know that two orders or an order of PPE was stopped at the border between the U.S. and Canada. You said Friday we had enough to get through a week to 10 days at current usage. Where does this put us now?
We have a group within the department, and in actual fact with staff from outside of the department, who are working on the PPE and consumables piece at the moment. We have an understanding from the feds that we're expecting a shipment of masks from Hamilton, which should arrive sometime today, and that's another 94,000 masks. In addition to our provincial supply chain, the federal piece, and our national buying, we also have some entrepreneurs looking to source as well. So it's no time for complacency, but I think we're in as good a position for our size and demands as many of the other jurisdictions in Canada, and we aim to keep it that way.
Do we have a question from Peter Cowan of CBC News?
Please go ahead. Your line is open.
Dr. Fizgerald, you mentioned that it's good for people to go out and for a walk, especially with the weather being improving at least. We've seen a lot of towns and cities shut down public spaces like parks, which means you have the same number of people, but they're pushed to different areas if they want to go outside. Does shutting down parks help or hurt when it comes to the spread of COVID-19?
So I think with a lot of these decisions, you have to look at the situation. I think for some of the jurisdictions that shut down parks, they felt that people were crowding together while they were enjoying the fresh air, and that was the reasoning behind it. And of course, that's not the intention. When I say go out and enjoy the fresh air, it's not to go out and then meet together and meet up and join bubbles, so to speak. So really this is about, if you're going outside, it's about going out within your own bubble, trying to make sure that you stay distanced from other people and just to enjoy the fresh air that way.
I do believe we have time for another round of questioning, and we'll start with Elizabeth Whitten of All Newfoundland Labrador.
Please go ahead. Your line is open.
Thank you. The other week, we were told there were plans to expand the local lab's testing abilities. Did this happen, and what is its capacity now?
We have actually a series of mobile drive-through testing stations across the province. We have arrangements for people who cannot drive, and we have in Labrador, cognizant of their weather, settle for fixed locations. So we do have more locations available to do the testing, but the people who are directed there do so on the basis of public health advice. The capacity of our laboratory has not yet been reached, and indeed there's new equipment being installed over the weekend. We are just waiting for some finalizing of a couple of last items that need to be delivered. So lab capacity is not an issue. We do have more testing sites now than we did 10 days ago.
Do we have a question from Peter Jackson of the Telegram?
Please go ahead. Your line is open.
Hi. I have a question about Labrador. This is kind of a scenario question of if Nalcor workers were landing on a charter and supposed to be getting on a bus, and some of them decided not to, got in their cars or whatever, how would someone report that? Would they report it directly to the authorities if they were, not taking instructions to go right onto the site?
Absolutely.
Or should they go through that that government the online form? How should they do it?
Absolutely. We have a public reporting form. I'm aware of an incident that could have happened this morning. We're following up on that already. This was one of with some change in shift changes that could have occurred in Happy Valley Goose Bay today. We're on top of that now. And keep in mind, these are for essential travels only. And so we'll be following up on, even though we do not have a public report form that would have come in on this instance. I did receive a call prior to coming down here, and we're following up on that.
The next question from Ben Murphy of VOCM News.
Please go ahead. Your line is open.
The number of funeral home linked cases continues to rise even 2 weeks after that incident. Why does this number continue to grow if proper contact tracing and self-isolation is happening?
Well, you've got to remember that incubation periods are additive. They overlap. So if, for example, the index case at that funeral home was 11 days into their incubation period, and then someone else who develops symptoms doesn't develop it till the end of their 11 days, you're looking at 22 days as a minimum. You will see those numbers continue to rise slowly, almost inevitably to some extent, as the contacts of the contacts become identified. So it's not unusual for that to grow. If you look, the rate of that growth is tailing off.
Do we have a question from Craig Westcott of the Shoreline?
Please go ahead. Your line is open.
Thank you. I believe there's been some evidence that there are actually two strains of this coronavirus circulating around the world, and I'm wondering if the testing being done by health department is specific to which strain is prevalent in the community.
So that information would be defined by the National Microbiology Lab in Winnipeg. That would require specific testing called genotyping, which is not, it's done there. So at the moment, what we are testing for are two specific markers, genetic markers on the virus, and so that is appropriate regardless of the strain.
Thank you.
Do we have a question from Patrick Butler of Radio Canada?
Your line is open. Please go ahead.
Hi, I apologize if I missed this earlier, but the facility in St. Lawrence, are you able to give us the name of that facility, any other details about it?
It's the only one there, and my recollection is it's the A.M. Guy Hospital.
Do we have a question from Kellyanne Roberts of NTV News?
Your line is open. Please go ahead.
Thank you. We know that we haven't been able to narrow down when our peak could come, knowing that BC is still seeing cases there. Are there any thoughts on summer events such as the Folk Festival, George Street, Regatta, if it'll be safe to have any large crowds that late into the summer?
From the point of view of our epidemiology, from the forecasting, we're looking forward to getting some modeling within the next day or so, maybe, that we would be able to share. The data that we do have from Public Health Agency of Canada suggests that this current wave may not die away in some jurisdictions till July now. There is also then talk about the risks associated with relaxing the distancing measures at that point for fear of triggering an early second wave. So I think that's a discussion yet to be had. I would seriously suggest to any organizers looking at festivals up until July, certainly, that the writing is on the wall.
Thank you.
Our next question is from Peter Cowan of CBC News.
Please go ahead. Your line is open.
The person who passed away, are you able to indicate whether or not they had any underlying health issues, and are you able to say whether or not this person was related to the calls cluster?
So they did have underlying medical conditions, and at this time I'm not able to say if they were related to the calls cluster.
Thank you. We have time for a couple more questions. So if reporters would just want to press star 1 to have your questions addressed, we'll take those couple of questions that call in first. Anything in addition can be emailed.
Thank you. The next question is from Peter Jackson from the Telegram. Please go ahead.
Hi. A landlord has questioned what their responsibility are. If they have tenants in a shared home, one of those tenants is not being vigilant about hygiene. What are their rights? What can they do about that situation, particularly with other people living in that home?
From a tenant's point of view, I mean, if the landlord is not comfortable with what we're seeing in terms of the level of activity that a tenant would be conducting, I think the prudent thing to do is report that, and no different than any other thing that happens within our province. If people are not following the guidelines that have been set out by the chief medical officer, well, we need to deal with it. I mean, people realize that, they could be that vector, they could be that conduit. And until we reach a point where people really truly understand that their actions and what could happen as a result of their poor actions, there is a consequence. The consequence maybe is to someone else. And I think the responsible thing to do for anyone, just not a tenant or a landlord, if they find someone who is not doing so responsibly, is to report those individuals.
Could I just jump in here? My memory being what it is, it's actually the U.S. Memorial Hospital in St. Lawrence. I am sorry for any confusion that has caused. I should know, I've actually been to the place.
Thank you. The next question is from Peter Cowan from CBC News. Please go ahead.
Most kennels have shut down, but in other places like Nova Scotia, they've kept those places open because essential workers, for example, are doing long shifts, need someone to look after their pets, or people who have to go into isolation and need someone to look after. Should we be keeping kennels open here?
So certainly we haven't heard of any concerns in that regard, but we're certainly, if anyone had any questions about it, we'd be happy to look at the situation on a case-by-case basis.
The time for questions has ended. Thank you for tuning in. The time for questions has ended. Please join us again tomorrow at 2:00 p.m., 1:30 in Labrador.
Thank you.